If you wish to submit a question during the presentation, please use the Q&A window in the top right-hand corner of your computer screen. Presenters will do their best to answer your questions. However, due to time constraints, not all questions may be addressed during this webinar. The presentation will now be turned over to Matthew.
Hello, everyone, and welcome to the latest edition of our 2021 Easy webinar series sponsored by Accurate Solutions and Nationwide Insurance. We are pleased to have with us today two experts who will talk through value-based care and how it can help save money. First up, we have Justina Lehman-Lane, VP of Value-Based Care with REVO Health, who will share her perspective on what's happening nationally, as well as how provider and employer relationships can work. Then we will have Dr. Owen O'Neill, Chairman of the Board at Twin Cities Orthopedics, one of our valued clients for over 11 years. He is also one of our medical directors here. Justina, take it away.
Thanks, Matthew, and thanks Health Easy for having us today. We are very excited to have the opportunity to talk about how us as healthcare providers can partner with you as brokers and TPAs and employers. So REVO Health was born out of Twin Cities Orthopedics. We are a managed services organization that provides value-based care solutions and strategies to local and national private practices. So how can everyone in the healthcare continuum benefit from value-based care? So I'm going to start first with patients and then move to the right of just a global perspective. So when patients are receiving value-based care offerings, the pricing is typically lower. It's transparent. They know what they're getting for the services and the price. They typically have improved outcomes because their whole entire clinical care is together and coordinated. They have an overall exceptional experience, and they have improved access because value-based care offerings removes the fee-for-service constraints and allows us as providers to tailor the care specific to the patient's needs. So for providers participating in value-based care, they typically have a higher patient satisfaction. No surprise at all. When you can remove all those rules and constraints of fee-for-service, you can really focus on the clinical care. They're incentivized for exceptional outcomes. So we tie that value-based care pricing to the actual clinical outcomes that are being delivered. With this value-based care environment, we are able to have efficiencies, and physicians can tailor their time to the patient's needs. So some patient may be a quick post-op check, while another patient may need a longer visit. Again, removes all those constraints that we typically live in outside of value-based care. We can improve access for patients, decreasing the payer hoops, right? So when we don't have to focus all of our documentation on billing and we can focus it on clinical care, you're going to see a shift in what gets delivered. And then physicians who participate in this have that guaranteed payment. For employers, it will allow you to focus on your employee health, control all of your costs, reduce financial risk, and have additional offerings to your employees. Nationally, employers who participate in value-based care, they actually have their health plan costs decrease. There's many patients too who engage in value-based care, and their employer will actually completely remove their deductible because it's such significant savings. So we know that's happening around the country. We have to figure out how to make that more common. And then in society as a whole, when you have providers and employers sitting at a table focused on what is the care the employee needs, what is the price, what are you going to get with that care, we can reduce the overall healthcare spending, achieve better overall health, and the best part, we can let people take home a larger percentage of their income because they're not spending those additional dollars on healthcare risk. So when we look at the healthcare ecosystem, where is care spent? And for years, physicians have been hammered on what is your cost of care, right? But when you look at the total cost, physicians are less than 20%. The actual clinical care costs less than 20% of the total healthcare spend. So where do those other areas fall in? The health behaviors of your employees and society. Social and economic factors, obviously, with everything happening in our country right now, this is becoming a huge topic on disparity. And where do certain patient populations cost more money just based on that social and economic need? And then the physical environment in which they live, housing and transportation. What's awesome about value-based care is it covers all of this. It creates an infrastructure where physicians can have a team of people to help with health behaviors, social and economic factors, and the physical environment the patients live in. Right now, if Dr. O'Neill in his practice wanted to hire a social worker, a health coach, a registered nurse, and a pharmacist, the current fee-for-service market does not pay him enough dollars to employ those in a private practice, even though we know that they're absolutely critical to the success of our patients. In value-based care, that pricing shifts dollars away from waste and puts them exactly where we're needed to be. And then he can create that team that covers all of these areas. So what is happening nationally that's creating more and more conversations around value-based care, clinical spend opportunities? So one big thing is Medicare has announced in 2023, the inpatient only list is going to go away. And what does that mean? That means that physicians are no longer constrained on where they can take these patients for their care. Physicians now get to decide where is the best, most appropriate site of service for the patient based on their clinical need. How that translates is you're going to see total joints being shifted more and more to the surgery centers. You're going to see spine procedures shifting. And how awesome is that? We're actually determining site of service based on clinical need versus billing. Right? So what are the value-based care discussions happening? What's the appropriate care? Does this patient really need surgery? Are they going to benefit from it? What's the appropriate time? Should they have surgery now or should they optimize their health to have surgery later when they're healthier? And then who is the provider that's providing them the treatment? Transparent pricing. This is not new. We've seen this over the course of the last few years, direct to primary care, where employers are paying per member per month for primary care. Maternity care, maternity bundles are becoming popular. Orthopedic bundle care, these are really the pioneers of value-based care. Orthopedics was a great place because those episodes are typically pretty predictable. And then we're also seeing a shift in oncology value-based care around should we be using community-based cancer treatment centers versus large academic centers for some of the care. And then how do we bring this together? And this is really a step-up challenge for everyone on the call today, is a call to action for all of us of how do we figure out how to get our patients to engage? And I say engaging patients in their own healthcare is like Amazon figuring out Prime delivery. We absolutely have to do this. Employers can have a huge part in this. We're seeing this across the country where if you receive benefit dollars to make certain choices in your healthcare, typically patients are going to. There's actually a practice, an employer out in California that does shared savings with their employees. So if I have an ACL in a hospital, it's going to be significantly more expensive than I have it in a surgery center. So if I was an employee of this employer, someone from that employer is going to let me know that if I make the surgery center choice and I'm healthy, I'm going to receive a portion of the savings that I created by that choice. So real dollars can come back on my paycheck because I'm engaged in my care. So for employers and providers, how do they come together? I have this dream that eventually they're going to sit at a table together. I think it's the greatest thing we could do in healthcare is if you sit providers and employers at a table, they can do a deep financial and clinical analysis. What are the clinical diagnoses of your patients? What's causing them to not return to work after surgery or having delayed return to work? What's having them take sick days? Where are they spending their dollars? So, for example, school district out in Nashville, Tennessee, their benefits manager did an awesome job he looked at where their spend was. 73% of their employees are female of childbearing age. They average 250 childbirths a year. So his strategy was, how do we have a maternity bundle that pays a professional fee regardless of the delivery type? And as such, he was able to save $3,500 per delivery last year, and he gave $2,500 of it back to those employees. So again, bringing that all together, tailoring a clinical offering to an employee's needs, passing dollars back to the employee. That's the dream world, right? That's why we're all here thinking we can create this change. It also creates transparency. If you sat with Dr. O'Neill today and you said, Dr. O'Neill, we did 60 total joints, total knees last year, what would that cost at Twin Cities Orthopedics in your ASC? He can give you a number. He can give you the exact price because that's what value-based care offers. So this can be overwhelming. It absolutely is changing the status quo. We always say when you look in healthcare, it takes 7 years from new evidence to come out and be a normal for our practice, right? 10% of people are innovators. So these 10%, they're out there, they're doing this, they have value-based care offerings, they're working with employers, employers are working with them. But for the remaining 90%, it's, I don't want to do that unless I have to, or that's really overwhelming and I don't know where to get started. So how you can get started is if you have a really great employer that's very engaged, that's focused on the health of their employee, reaching out to the private practices in the community to say, what are you doing for value-based care? Concierge navigation, having someone with your employee on their journey. Healthcare can be complicated, doesn't need to be, but it can be. Getting them into the right physician in the right time at the right location. And many value-based care offerings, you will see that they offer that concierge navigation. Transparent pricing, that's crazy, right? To know upfront what you're going to pay for something, that exists in value-based care. Understanding your health plan costs, where do you spend money and where are those areas of opportunity if you were to have a clinical strategy. Transparent pharmacy benefits, looking at where is that spend and the opportunity. How can you work with patients and employees to get them engaged in their care? Right now, General Motors spends more on healthcare than they spend on steel. Starbucks spends more on healthcare than they do coffee beans. So we know that healthcare cannot keep increasing the way it is. So how do we get those employees to be engaged where they're a partner? And it creates this nurturing environment of we're all in this together and we can create really good healthcare if we're all engaging and doing our part. And then payment integrity, something that never used to be on my radar as a provider, is a large percentage of healthcare dollars are purely for fraud. I was recently talking to an employer who said that at one point in 2018, they spent dollars on 3 hysterectomies for a male patient, for a male employee, right? And that fraud was not caught. And so being aware that there is fraud. And then again, healthcare does not need to be complicated. So quick thing that we are doing in iHealth, Dr. O'Neill is going to talk specifically around orthopedics. We're working on a maternity care solution, providing employees a path to delivery of highest quality and experience. We're having, again, like I mentioned, that concierge navigator that is with that employee on their whole entire journey from conception until the 4th trimester, the postpartum period. We have bundled services to make it very simple for the employer to know what they are signing up for. We've focused areas on everything that can increase the cost of a pregnancy. NICU, increasing C-section rates. So we're targeting that. We're pulling back the curtains and we're saying with value-based care, we're going to look at every reason why cost gets increased and we're going to target those areas. So again, in summary, before I turn it over to Dr. O'Neill, providers and employers can absolutely partner on improving care and decreasing costs. Absolutely. Will this be uncomfortable for employers to talk about their employees' healthcare spends? It for sure will be. This can be easy. It likely won't be easy when we add in all the complexities that exist in the status quo. We can design care for your employees' needs. And then again, we can see big benefits when we engage those employees in actually how we benefit redesign their services. So again, if they're making great choices, they should receive some of those dollars from that savings back. And that's going to create a very, very engaged model of patient care. I will turn it over to Dr. O'Neill.
Sounds good. Thanks, Justina. And Justina has absolutely been critical in terms of moving the ball forward on our value-based care platform. Appreciate everything she's done working for both REVO and TCO. So I'm president of TCO. We have 110 physicians, orthopedic surgeons, and ultimately we started down this value-based care journey 8-9 years ago. And I think when we started this journey, we really tried to understand what is value-based care. People like to toss that term around, but in reality, we need to understand that. What we've basically said is, in what I've said from the beginning, Justina and I have said, is that it's really better care for less money. But what does better care mean? It means a couple things. It means you really have to have better outcomes. So your patients actually have to do better. So value is outcomes plus the patient experience, which is basically patient satisfaction. So you take outcomes and you add patient experience together, and you divide that over cost. So meaning if you have similar outcomes, similar experience, but it costs more, you have less value. So to create better value, you need better outcomes, a better experience for the patient, and you need lower cost. And that's really what we have focused on at TCO since we've started our value-based care journey. See if I can slip to the next slide here. There we go. Whoops, go back. Sorry about that. So again, first of all, you have to measure outcomes. So TCO measures outcomes by gathering patient-reported feedback following surgery. I'm going to tell you in a little bit how much we actually gather. We then gather our experience from the patient. We measure that experience by, again, gathering those patient-reported feedback following all visits and all procedures. And then when we define cost, because people can be a little tricky on cost, we simply define that cost as total cost of care within the entire episode. Not what the patient responsibility is or what that surgical day looks like, or 2 weeks or 3 weeks, but what the entire episode of that care center looks like. When we look at our outcomes, and just so you get a sense of what we collect, so preoperatively we collect a myriad of scores. There's things called the HOOS and the COOS and the PROMIS score, and a MED evaluation, and a VAS score, which is a visual analog scale for pain, and all of those things. So we collect basically a boatload of information from our patients. We then start, that's preoperatively, so it's important to know what a patient's baseline is. And then 2 weeks postoperatively, we start with medication questionnaires. We then advance that again to the, when we talk about these scores, HOOS and COOS and PROMIS scores, they're all basically patient activity scores and pain scores and satisfaction scores. We then look to see, gee, was there any adverse event? Did something happen to the patient? And we actually ask the patient whether something happened to them, because a lot of times people report outcomes and they sort of say, well, gee, yeah, nothing happened. And that may be because the patient went to someone else's emergency room, right? We want to know the full outcome of the patients. We then check all those scores at 6 months post-op as well as a year post-op. So we continue to follow the patients throughout what we consider to be the full episode, which is more than just the bundled portion of that episode. So we developed what's called the Excel program. We developed this program 9 years ago, and it was developed in an effort to advance orthopedic medicine in terms of taking care of patients with a total coordination of care from the time before their surgery to a full recovery in the episode of care. It was a single fee bundled payment that included inpatient education, the surgical procedure, all the medications, the post-op recovery, the physical therapy, the anesthesiologist, the surgeon, basically everything for 90 days. We started with total joint procedures for knees, hips, shoulders, and ankles, And then we added spine cases on. The average savings for these procedures versus a traditional hospital setting in terms of total cost of care, and we know this because we designed it this way, is 30%. So it's 30% savings from a traditional model, again, with what we would argue is better outcomes, not equal outcomes. So for us, as Jen Justina said this, transparency is absolutely the key, because there is no transparency in healthcare, and it seems like we just can't get there fast enough. So what we do is we published our rates, and people say, well, you can't publish your rates. No, we publish them. They're the same for all commercial payers. You know, it's a different pay for Medicare, but it's the same for all Medicare patients. We basically own the bundle. So we own the bundle. It's our bundle. We then have a process to pay the vendors. We're almost like a mini TPA. I'm sure Health Easy loves to hear that. So we make sure that the individual providers don't bill the payers separately, and that we're transparent in our pricing. And for us, we felt it was critical that, again, how can we move the needle? So we move the needle by dropping 30% off sort of known commercial rates in the community. We knew that that would move the needle for those people that pay the bills. Okay. When we look at the overview of the program, again, we're the contracting party, TCO is. We have one fee, it's transparent. These fees are published. Total knees, $24,000, $25,000 for total hip, $24,000 for shoulder, very similar, all within the arthroplasty category. And then the lumbar fusions, whether it be cervical or lumbar, are added in as well. And so we've published those to the payers. The payers wanted us to, people wanted special deals and they wanted a different price. And we just said everyone pays the same price. And I think that's been very elucidating for people. The bundle includes anything from the day of surgery through the 90-day postoperative period. As I said, it essentially includes everything: anesthesia, facility, surgeon, implant, includes everything. We have orthopedic care suites. There's a lot of talk about outpatient total joints now, and our patients leave the surgery center and they are absolutely outpatient in the sense that they leave the surgery center, they meet discharge criteria. But whereas we could send them home, the biggest issue is we believe this is more of a concierge care. And so in this concierge model, we believe that patients are better cared for overnight by us. So we have our own care suites, and those care suites have physical therapy, 24-hour RNs, we have medications, we have labs, we have food, we have internal medicine visit the next day, the ortho doc sees them the next day. And so that includes everything, including the care suite and their post-op visits throughout the 90-day period in the bundle. When we look at the environment, it's really critical. I say to patients every single day, I say, look, this looks like a nice spot. We can build any facility, but the key is the staff that we have in our facility. And that starts with the leadership team, with people like Justina. And that means changing current environment of healthcare. We need staff in the care centers that are absolutely can-do people. So we hire people that focus on high quality and efficient care, improving the health of patients, and that they're nice. Every patient says they just can't believe how great the care team is. When we do that, when you develop a bundled care environment, we are then free to add in things that provide better value for the patient, but aren't necessarily reimbursable through a traditional environment. So that helps us eliminate these silos within an episode of care, because we're all working toward the betterment of that patient. Creating a great environment where, number one, patients feel like they're really cared for well, and that we can create data that is reproducible data and data that we can report to others, which I think is critical. We also have an RN, a concierge. Again, we consider this to be concierge care. So we have an RN, nurse coordinator, that really initiates medical screening. The important thing for us is when we look at a lot of what we do, whether it be spine surgery or knee and hip surgery, and that is one has to optimize patients. So there's a bunch of factors that we consider to be, optimizable factors, or things that a patient could change. There's some things a patient can't change, but there are things that they can change. That includes their diabetic control, like HbA1c. It includes things like their weight. It includes whether they're smoking. There's a bunch of things that they can control, which directly affects their outcome. And so we have a very rigid criteria by which we say to patients, we say, look, we're here to help you. We're here to help you and have the best result possible, but you have skin in the game too. And your skin in the game is that you need to modify any risk factors that are modifiable before you're a candidate for surgery. Just because you have an x-ray that shows bone-on-bone arthritis and you got a lot of pain doesn't mean that you get to have an operation. It means you're in the game, and we're willing to help you. We'll help you in that journey, but they have to have skin in the game. Our RN coordinators really help us with that process, and so they help with scheduling, the H&P, getting the patients ready to go. There's a joint class. We believe it's really important that patients know exactly what they're dealing with, so joint education is important. We tour the suites. We do all those things in coordination with the RN coordinator, which is absolutely critical. We have our partners. We have, we're a big practice, so we have surgical center partnerships with our ASCs. We have 6 ASCs. We believe that, there's no question when you look at ASCs that there's a lower infection rate, there's higher quality, lower infection. And so we partner with those ASCs. In our bundled care environment, the ASCs all get paid the same. So it's not the Wild West in terms of what people are charging, which is what we see in other environments when I do reviews actually for Health Easy across the country. We have dedicated and special equipment for total joints and the spine procedures. When we look at our care suites, we have RNs with acute care experience. We have very tight nursing ratios. Up on the hospital now, they have 1 to 5 nursing on the floors. We occasionally get to 1 and 2, but so we have a higher touch environment. Again, go back to what we said. We're providing better care for less money. Okay, we have great education. There's physical therapy on site. We have an internist that sees them the next day. Surgeon sees them, and the swag. So believe it or not, the TCO apparel, where we have TCO swag, it's really important for patients. I have patients that come in 5 years post-op with their TCO swag on. They're a advertisement in the community, and they come in and they want more swag, so we happily give it to them. So that's a big deal for patients. They want to be part of that club when they're part of the Excel program. Sorry, let me just mute this. Apologize. So what are the financials? So we've had 28,000 invoices paid to external businesses. Again, we treat ourselves as a TPA within this bundle. We paid $38 million in expenses in 2020. That includes prior auths, insurance checks, insurance benefits, patient phone calls. So we hire people to do that. So pretty robust program within our practice. You'll see the numbers here in a second. When you look at our volumes, we started with 11 patients in 2012, I think that was. This is all organic growth. We've never advertised 1 minute in terms of this program. This is all patient growth and patient word to word. We were at 1,800 in 2019, and believe it or not, we added another 200 even in the COVID year. So we're at a little over 2,000 last year in 2020, and we're going to blow that out of the water again this year in terms of number of patients. So it's exploded in terms of its care, and it's because of its care of patients. Patient volume, we've done this on 7,200 patients, super low readmission rate, ED rate, revision rate, surgical site infection. That's all speaks to our team, and again, the optimization of patients. So just because you have a joint that needs to be fixed doesn't mean you can just go get your joint fixed next week. It means you have to be a partner in your own care. And that's what this data speaks to, is that super high success rates, because we help manage patients and we help them down that journey in terms of getting better. Again, in 2020, so we saved, whoever the payers were, $24 million in 2020. $80 million of the life of the program. We take financial risk in the program. We have surgeons that have a gain share, a risk share within the program, so surgeons have skin in the game. We are absolutely the market leader, not only in bundled care across the country, nobody's even close to what we've done, but we've also collected 3.3 million patient-reported outcome data. So again, it's important for us that we collect that data for patients, and that we think drives our practice and leads to even better outcomes. So 99% of our patients say they'd recommend a TCO to friends and family. I think the other 1% didn't like the food in the suite. So we're doing the best we can and with that. Average cost is again $24,000 for a total joint, and that's with we would call that a higher level of care. So when we look at our business partners, we think about the insurance companies. Okay, insurance companies, we actually invite them to come visit our surgical center, invite them to come see our care suites, meet with the medical director, know what sort of care being delivered. When we consider our best allies, we really consider it to be the employers, and through that are people like yourselves that are brokers, because they're ultimately paying the bill. Employers are paying the bill, and when you're in a fully insured model, frankly, the insurer is taking all that excess, or the hospitals are taking the excess. So when someone's paying the bill, if you can develop value-based care where you're delivering better care for less money, that's really the key. When we look at, there's a lot of talk about direct-to-employer contracting, and it's a great marketing product. People love to talk about it, but at the end of the day, what I would say is the employers do not want to directly contract with providers. What they really want is they want a benefit design platform or some way that they can incent their employees to go to providers and people that are taking better care of them in a value-based basis. They don't want to directly contract with us as much as we'd like to think of that in orthopedics. They just don't. So that's where really the focus is on more benefit design than it is on actually direct contracting. And that's really where I think brokers are super helpful. And in our experience, they're helpful because they're the ones that are working directly with the employer. So they're the ones that are helping the employer choose a health plan, choose a TPA, deciding whether they're going to be fully funded or self-funded. And so they're always looking for products that provide value to their client, and therefore providing value back to their services as a broker. So they can very much help with plan design changes in this type of environment. So we've been very happy with those relationships that we do have. When we look at the health plans, candidly, they have very little incentive to steer patients because they've got some backdoor deals with the hospital, backdoor deals with X, Y, and Z. They don't care what things cost because it just gets transferred right back to the employer or who's ever paying the bill. So they do not care. The only exception that we've really seen has been United Health. And of course, United Health, the exception with United Health has been that they have spine and joint centers of excellence, and we were the first joint center of excellence in an ASC in the country for United Health. And of course, what they do is they sell the program to employers. So the employer pays more to be able to access our program. So we've seen United Health, even locally, steering quite a bit of patients to us as a center of excellence for them. So there's the end of my formal presentation. Any questions? Be happy to answer them, both Justine and myself. And Matt, maybe someone's got questions for Matt, like when did you last shave?
I shaved pre-COVID, I think was the last time.
Okay.
We have a couple questions here. I think the first one is, Justina, you talked a little bit about incentivizing members to go to TCO or to look for valued care. What are some of the best incentives you've seen work for employers? And have you seen any employers that have been able to get members to travel, like for example, from either Duluth or St. Cloud to the Twin Cities?
Yeah, great questions. We've seen a lot of different employers approach this differently. I think Dr. O'Neill kind of hit the nail on the head. I think you got to be careful with how much you narrow your network and giving patients choice, right? Because we don't want to see a patient that felt forced to come to our practice. So incentivizing them. Best things I've seen is shared savings. So they take whatever the hospital charge would have been, less the ASC, and the employee gets a percentage of that savings back at year end. And then we've also seen savings in the maternity space of actually moms can earn additional time off. So that covers both options. Do you value money or do you value time?
Yeah, and I think, a couple things about that. You can, I actually met with, I was on a panel last week with Walmart, and the Walmart folks said, their Centers of Excellence program has been a bit of a bust in terms of making people travel to centers that are hundreds of miles away. Because look, if there's a problem with the patient, you're not going to have providers that want to take care of them back when they get to their environment. And what they have found was it helped them more in terms of selection criteria than anything. So just a comment about that, and then the other comment I would make is in terms of incenting your client, your patients. When I first started practice, I'll never forget this. I was amazed by this. I was part of a focus group, and I was sitting behind a one-way mirror, I guess. And patients were quizzing patients about what does it mean to change providers. And it looked like we had, as providers in general, we had about a $300 leeway with patients. Like if patients had extra payment out of pocket of more than $300, they sort of said, oh, well, I think there's this other guy should be pretty good too. So money's a big deal for patients, right? So I think what you have to do is when you have a plan design, you have to say, there's some sweet spot, and you can either, you might be able to give them a gift card. You give them a gift card for $1,000 or $500. That will change their behavior. There is no question about it, whether it be a gift card or whether it be they have a higher out of pocket, or they have, the best thing is they have no deductible or no out of pocket if they go to the preferred provider or the value-based provider, because you're going to save thousands and thousands and thousands of dollars. So that's what United Healthcare has done. And I've had patients come in the door that were scheduled with another ortho group in our town and came in and said, I'm scheduled, but I'm coming to you because of my benefit package. They weren't mad about it. They just said, look, I don't want to pay that out of pocket. So I think you got to design it as an out-of-pocket experience.
Yeah, I totally agree. And what we have seen not work well is the employees that don't pass on the savings and they mandate it. We worked with an employer in Wisconsin. They had a 30-year employee history. They met with him and asked him to get his total joint in Minneapolis. He said, great care. His wife said, why couldn't we see our orthopedic surgeon that we'd seen for years? We had to drive 7 hours and we got nothing. So I think, like Dr. O'Neill says, you have to be very thoughtful in how you do that design.
Makes sense.
Carrot or the stick. You decide whether you want a carrot or a stick or a little bit of both. And if they got to drive, I'd use the carrot. If it's locally, you could use a little bit more of a stick. But if they got to drive, they're going out of their way to go to a different provider. I think you have to use a carrot, and you can use a carrot. We've done legal review. You can, and I'm not a lawyer, so I'm not telling you how to do it, but I believe you can give them gift cards and things like that.
And I would say too, for Dr. O'Neill and I, we've led with clinical outcomes, right? We want you to send patients to us because we give you good care. And that would be my advice to employers is don't just look for price. Make sure that you're getting that really good clinical care when you're working with practices.
Yeah, value is not the lowest cost. There's no question. The lowest cost can get you a boatload of complications in a hurry. So value is not lowest cost.
And that was the next question here. Do you have any information on how the coordination of care from pre-op to post-op has helped improve the overall outcomes for the patient?
I do. Dr. O'Neill's laughing. In a regular, uncoordinated service, your employee is going to typically interact with over 30 people. In a coordinated model, it's going to be a nurse working directly with Dr. O'Neill. So patients are going to feel comfortable with their education. They're going to have a point of contact at all times. And what that translates into, not only just a great experience, decrease clinic visits to say, something's going on. Is this normal? Is this not normal? Decreasing emergency room visits because they've built that relationship with that one person who has direct access to your surgeon.
Very good. I think we're running up against the end of our time here. So thank you very much, Dr. O'Neill and Justina, for presenting with us today. And thanks again to AccuRisk Solutions and Nationwide for sponsoring our Easy webinar series. And please join us again on July 14th, where the title of the webinar will be Summer Skin Check.
We will not be involved in that, but I look forward to getting my carrot, for doing the webinar.
Thank you.
Today's presentation on behalf of the presenters and Health EC. Thank you for joining.